First of all, I'm very thankful to the organizers, especially Apollo Management, Dr. Sangeeta Reddy for inviting me for this 7th International Conference on Transforming Healthcare with IT. I am working with the National Drug Control Department under the Ministry of Health and Family Welfare as Joint Drugs Controller of India. I think as all of you know, in healthcare system, pharmaceuticals plays very, very important role. Almost 70% of your out-of-pocket expenditure towards healthcare is towards the pharmaceuticals. India really playing a very, very important role in the not only national public healthcare system and include in even global healthcare. As you know, our pharmaceutical industry is really considered as a global healthcare industry, and India is always visible as a pharmacy of the world. As you know, in India we have almost 6,000 pharmaceutical manufacturing units, which is contributing almost $31 billion, out of which $16 billion is towards the exports and around $1,500 for the local consumption. That means almost it is 95,000 crores in India. We are almost exporting our pharmaceuticals to more than, you name any country in the world, our pharmaceutical, Indian medicines are available. Even some of the countries which are even not reflecting their names in the United Nations or WHO list, still our Indian pharmaceutical industry medicines are available in the shelves of the pharmacies in that country. In India, the drugs and cosmetics are regulated under the Drugs and Cosmetic Act. Under this act, we are regulating the manufacturing, sale and distribution of pharmaceuticals. In my presentation, briefly, I talks about what is the ePrescription and ePharmacy in India, and what are the different types of prescriptions and different models of ePharmacy, and what are the benefits of ePharmacy and disadvantages of ePharmacy, and what is the at present international scenario of ePharmacy and Indian scenario, and what government is thinking to address the ePharmacy issues at present in India. As you know, in India, we have almost 0.8 million retail and wholesale shops, premises are registered or licensed under the Drugs and Cosmetic Act. Out of 0.8 million, I think it is almost 65% of which are mainly involved in the retail pharmacy. For sale of any medicine under the Drugs and Cosmetic Act, you require to have a license, as well as you need to have registered pharmacist for dispensing of the medication. So coming to the ePharmacy, so before that ePharmacy, just as all of you know, if you see the e-commerce mainly talks about that it is a non-store retail format to cater the growing market. And under that, one of the major nowadays component of the e-commerce is the ePharmacy. The government of India is very keen showing interest on the e-commerce. You may be knowing, even yesterday, our Honorable Prime Minister has taken a meeting on e-commerce in India with all the top bureaucrats, and one of the major agenda item is the ePharmacy. What are the issues at present with the ePharmacy, how government of India would like to address that issues relating to the ePharmacy. ePharmacy, mainly it is a sale of medicines through the website, through the intermediaries. I will come to know what are the intermediaries, how these models are working in India. But unfortunately, the ePharmacy is not specifically recognized under the Drugs and Cosmetic Act. So Act says that it will regulate the sale of medicines. Whether it is offline or online, it is not stated. So unless that sale is complying with the provisions of the Drugs and Cosmetic Act, so there are no any violations. But however, the Act is silent with respect to the internet pharmacy, but still we are allowing the internet pharmacy because of Until unless there are violations, then only regulators will involve to control the sale of such type of e-pharmacy. And also, as I said, there is no explicit prohibition also under the Act. So these are required to be operated under the license and in accordance with the conditions of the license stated under the Drugs and Cosmetic Act. I think as all of you know, if you see the growth of internet users versus mobile internet, I think it is going with very high speed. The number of internet for mobile users having internet, and this is the way growth is taking place since 2012 to 2016. And another interesting thing, this data what I am showing you in source of by medicine and other relevant next slides, it is the data source is from the FICCI survey. It is not from the Government of India survey. It is the data obtained we got from the FICCI source. And if you see as per the source to buy a medicine, 68% of the patients personally they visit the medical store to purchase the medicines. And in case of those who are ordering medicines online over the internet, the same that patient or person himself will 68%, 61% is ordering. And the places where patient make order over telephone call is around 20%. And in someone else where medical store, some people visit directly, it is a 10%. Someone else orders the medicines over the internet. Other than patient, it is 5%. And some frequency of buying of medicine in India, this is approximate figures. As I said, this is figures taken from the FICCI. I think if you see 37% is once in 15 days the frequency of medicines we are purchasing, and 46% is around once in 4 months, and it is 9% is once in 3 months, and 5% purchase once in 6 months. And need to visit multiple pharmacies. This is one of the very interesting thing. You may not able to get all medicines at one pharmacy. The patient may need to visit multiple pharmacies to get all medicines that have been prescribed by the physician. So I think when the survey is conducted, they say that 48% says that they are visiting multiple pharmacies, and 49% says yes, they are getting at one place only. And if you see the revenue share of Indian pharmaceutical in India, so generics contributes 70% almost, and the OTC is around 21%, and 9% of patent, and actually 9% of the market contributes only the patent medicines. And if you see in India, the different, not only this is actually what I am showing you next types of prescription. This is not India's practice, it is generally global practice. Generally the physician we have three types of prescriptions. One is the paper prescription, next is electronic prescription, and third one is the telephonic prescription. Okay, but in India, under the Drugs and Cosmetic Act, only paper prescription, that is written prescription, is only accepted under the drugs and cosmetic rules. Because the rule says that prescription should be signed by the physician. So under the Drugs and Cosmetic Act, only one category of prescription practice is permitted. However, globally, there are different ways of prescribing. For example, paper prescription, where the doctor directly hand over the prescription to the pharmacy without the patient there. And there are paper prescription, the doctor gives prescription to the customer, patient, and patient goes to the pharmacy for getting the medicine. And in case there are in instances, even globally in USA it is permitted, the doctor call the pharmacy through telephone to dispense the medication. And some countries they accept the even scanned or fax copy of the prescription, but in this case the doctor has to send a scanned copy of prescription directly to the pharmacy, not scan copy fax to the patient. Similarly, the electronic prescription, the doctor should generate the prescription and send directly to the pharmacy, not to the patient. And if you see models of ePharmacy, there are two types. One is the marketplace model, and another is the existing licensed pharmacies, where marketplace model, in this case, this is also called as the intermediary. These people, they don't have any physical stock of medicine with them. Just here the intermediaries, they will collect the prescriptions, either scan copy or photocopy of the prescription through electronically, and they will provide to the nearest pharmacy where the licensed pharmacy is existing for supply of the medicines to that particular needy patients. This marketplace model is nothing but, for example, maybe when you book the tickets, flight tickets, whether it is a Make My Trip or any agencies. Make My Trip, they don't have their own flights, but they will book the tickets for other airlines. So similarly, here marketplace model, they don't have actually any pharmacy with them, but they will get the prescriptions and they will further transmit the prescription to their licensed premises for dispensing of medication. There are other model existing licensed premises, where the pharmacy is holding the license, he is also supply the medicines through online. So here the customer will either scan the copy of the prescription or take a picture of the prescription. He will upload on the intermediary platform, either through web or mobile platform, and they will receive the prescription. They will validate the prescription, and they will identify which is the nearest pharmacy can able to supply. They will give the copy, forward the copy of the prescription to the nearest pharmacy, and these pharmacies are operated under the Drugs and Cosmetic Act. And generally, these intermediaries are mainly regulated, controlled under the IT Act. So under this IT Act, intermediaries, one of the major issue why internet pharmacies still we are not directly endorsing is intermediaries, as per the IT Act, they are not responsible for quality of the medicines they are supplying. That is one of the major drawback with the IT. See, why the intermediaries are not responsible? For example, even if you say when you book the ticket from any Make My Trip, if the flight get delayed, Make My Trip is not responsible for the delay. Though you purchase the ticket from the Make My Trip, but Make My Trip is not at all responsible for any cancellation of the flight or any delay in the flight or any eventuality. Similarly, here in the intermediary also, who is actually collecting the prescription and giving to the nearby pharmacies, this person who is involved in this business, he is not responsible for the quality of medicines. Tomorrow, for example, the licensed pharmacy supplied any not of standard quality or any other spurious drug, these intermediaries are not responsible under the IT Act. So this is one which is contradicting with the Drugs and Cosmetic Act. But however, the IT Act says it is superpassed. This is actually superpassed all the other regulations. That means IT Act, what regulations are there, it will supersedes the other regulations. This is one of the weakness at present in our system. So I think, as all of you know, if you see the benefits of the pharmacy, one of the major benefit in the patient convenience. I think medicines are available at the doorstep of the patient. This is mainly convenience and also accessible to the patient, and it improves the availability of the medicines. Another very important, you can have the complete data available with that particular patient, and also it is able to get completely the prescription practice of the physician, what type of medicines is prescribing for particular disease, and is there any rational use of the prescription. The complete data will be available with the ePharmacy. And another important thing, the patient is able to get a better product information either through through the internet or through the messages, and patient compliance is also very good, and there is a transparency, and also the medicine's authenticity is also assured. Next slide, please. And that there are some problem with the ePharmacy. Next. There is a high risk of self-medication because of medicines will be easily available. There is a risk of development of resistance to the medicine. And I think you are well aware. Just I will directly go to what Government of India is thinking. This is the areas actually what we need to clarification from the Government of India. So what ePharmacies, those who are doing, there is no clarity in the regulations because of whether the online pharmacy is required to be registered with Indian regulators, whether definition of online pharmacy and OTC drug is actually not available, and there is no validity of the prescription. Once the doctor has prescribed the medicine, so what is the validity of the prescription? Within 1 week or 1 month or 1 year that medicines need to be dispensed or not. And electronic prescription, digital signature, at present Drugs and Cosmetic Act, it is not accepting. However, IT Act, it is complied. And what is the actually role of intermediaries if some not of standard quality or spurious drugs are supplied? And what is the area of jurisdiction? For example, intermediaries located in Agra is supplying medicine in Chennai. If something goes wrong with the medicines in Chennai regulator don't have a control in the Agra. So that means what are the jurisdictions for the regulators to take any action? And electronic records, I think today's inaugural session, one of the important area discussed is the confidentiality of the patient information and also the public awareness. Next slide, please. So with this, what Government of India is going to make recommendation, going to be implement is that online pharmacies are going to be registered with the Indian drug regulators. This is one of the proposal to be placed before the government. And we have now defined what is online pharmacy. So for that, we are going to creating a national portal. Government is creating a national portal for the online pharmacies, and all online pharmacies has to be registered with the government, and all intermediaries shall have at least one licensed pharmacy in each state because of to cover the jurisdictional issues. And online sale of drugs may be permitted only on e-prescriptions or electronically generated and digitally signed in compliance with the IT Act. Next slide. And because with this online pharmacy, the important thing is that anytime you can have the audit of the prescriptions. And one more thing, you can entire audit trial can be carried out with all the name, address of the patient, physician, and pharmacy. And certain categories of drugs, we are going to be prohibiting the sale under the internet. Especially, we have prepared the negative list, what we call, mainly that is including narcotics, psychotropics, tranquilizers, and habit-forming drugs, and also Schedule X drugs. And we are going to be having mandatory provision for the confidentiality of the information under the IT Act. And also, to have all these provisions under the Drugs and Cosmetic Act, we are going to be amending the drugs and cosmetic rules to include, to legalize, I can say, the e-pharmacy practice in India. Thank you very much for your attention.